All right. Welcome, everybody. This is our webinar number 13. Very exciting. Today is a big one. Today is the shoulder and using Spidertech. This is how I personally got into using Spidertech. It helped me tons. It really changed my function of my shoulder, allowed me to treat properly again, to be athletic again. And then also I've just had such great success using Spidertech for shoulders with patients and family members. This is a big one, and we're going to get into some great research today, some new research, and hopefully leave here with a ton of good ideas and clinical ideas as to how you can use it with your patients later on today to help them. So if we dive right in, here at Spidertech, we're staying very consistent. Essentially, we want to give you the best possible product, arming you with the highest level of kinesiology tape, highest quality of kinesiology tape, to enable you to help your patients. If we look briefly at my track record here, tennis and golf is where I spend most of my time working in the past, and now working in a multidisciplinary clinic as well. I've been able to help many people with shoulder issues with Spidertech. I mentioned before, this is how I got into using the tape myself, and so this has been a big piece of my career, being able to help people and get great results, not only right away, but while they're on the field, while they're on the court, or while they're at home playing with their grandkids, while they're doing whatever they care about doing. The beautiful thing about our kinesiology tape is you go home with it, and the therapy continues throughout the day, the entire time you're using it. We look at our goals for today. We're going to keep it quite simple. We're going to learn how to use and improve shoulder function with Spidertech kinesiology tape, and then we're going to go through a couple applications, how we can use tape in different ways to affect different types of diagnosis of the shoulder, different patterns, and different issues that your patients might have shoulder-wise, that we can kind of customize our applications to their needs. What kind of allows us to stand apart from our competition here at Spidertech is our Pro Cuts. We have pre-cut kinesiology tape that makes it easy for you. Because it is machine cut, because it comes the same every time, it makes your life super easy. It's standardized. It lasts longer because, well, our adhesive is made right here in Toronto, Canada. We have the highest quality, in my opinion, products that are materials that you can get. It's very reproducible, and it saves time for you both in the clinic and outside the clinic, depending on where you happen to be applying kinesiology tape. All right, if we dive right in here, we're getting right into the excitement. These are the type of patients that we're going to take a peek at today. I was hoping with this is that you can think of the patients that you see on a regular basis, people that you could help. And so if we provide a solution for a range of motion issue in the shoulder, secondly, and it kind of goes along with it, if we can help your patients improve their proprioceptive awareness. Generally, this will be after an injury. Generally, this will be when they're fatigued that we get the most benefit from a proprioceptive boost. Essentially, we're aiming to get them back to their healthy state or their healthy awareness of their shoulder in space. We'll look at how muscle tone and tension can be improved by using Spidertech on their shoulder, and then also how we can improve their posture, their positions for more of a structural application to help with someone, for instance, who spends too much time on the computer or looking at their phone too much. We get kind of rounded forward. And then lastly, we're going to dive into how Spidertech improves pain in a couple different ways. And then we'll look at fluid flow, lymphatics, and our example today will be with delayed onset muscle soreness. But really, this is how we can use tape to affect any fluid dynamics, swelling, inflammation, bruising, as well as lymphatics. that are affected by the shoulder, and really through the axilla and the whole upper limb area. Okay, so that was certainly a mouthful. We're going to dive right in. This first study, and the goal with our studies is to help you, I guess, believe what I'm saying. That's probably helpful. But also it's to give you an understanding as to how much benefit you can expect to see with your patients. We all understand that we're going to use Spidertech in concert with many other different techniques, modalities, and so we want to know how much to expect benefit-wise with using tape. And as I mentioned before, one of the huge pieces to this puzzle is that Spidertech really stands alone because the benefit is seen while you're not seeing the patient. The benefit is seen while they're at home. It really takes the place of nothing that you're currently doing. You just do your normal treatment and then add tape as the finishing move at the very end. Okay, so our first study, this is a 2024 study. This is, I believe, from May. Hot off the presses. It is looking at Ehlers-Danlos syndrome, and I'm sure everyone's aware, but this is a feed my bias, which is that we can help these type of so we can help patients with these type of injuries, whether it is actually diagnosed Ehlers-Danlos or it is someone who just has hypermobility, joint laxity, and we're trying to kind of improve their awareness and positions, as well as help them express their normal function, range of motion, things like that. So the interesting thing about this one is that we have a population of people who expresses hypermobility, and we're also looking at the outcome measure is if they are increasing range of motion. It seems like an odd kind of thing, but in my experience, what you end up seeing is that due to muscle tension, that a lot of areas, although the joint is lax, the body kind of tries to lock areas down and produce stability in areas that aren't functioning properly. So with the tape, although they might still have joint laxity, the brain would generally kind of affect the range of motion if pain and dysfunction is there. So in this population, we have just that. These are people with shoulder pain with kind of that hypermobility from going onto the shoulder. So if you look at our image here, the one on the right-hand side, which kind of is our experimental group. The one on the left is the control group. That opens a completely different bag of worms in that I think that this is kind of a ridiculous control group in that it's going to have benefit just having tape on there as well. So it might not have the maximum amount of benefit that what they've done here is they try to tape it in like a professional way versus just like a throw it on way. But just throwing it on is not just neutral. It certainly is better and significantly better than nothing. But with having said that, we'll jump right in. What we see here is right after the tape. These are the degrees in which we saw improvements. So as soon as they put tape on, we saw a 9% improvement in active external rotation with shoulder. We saw after 2 days, we saw an 11-degree improvement of external rotation with using tape. And so again, I don't think this is something where you're like they're finding new range of motion. I think this is the tape on their shoulder helps them express their normal range of motion that had been decreased by the fact that they were experiencing shoulder pain. We look into our internal rotation, we see a similar thing. We see a 9% right away, an 11% improvement after 2 days, and then a overhead flexion position. We see a 6-degree improvement right away and a 7-degree improvement after 2 days of function. So really impressive numbers here. I just chose the right arm to look at. I think the left arm is the same, but we can also see that a lot of times that the control group saw benefits as well. But regardless, I think that although there's numerous studies that show this similar type of thing in terms of kind of restoring range of motion, these are kind of consistent numbers that we would expect to see. So we can expect to see kind of that 6 to 10% improvement right away, and maybe a little bit more than that after a couple days. So within your patients, test, retest, see if you get the same results. I do all the time, and it's kind of a magic trick to show them that right away they see benefit, and it certainly helps to buy in and them understand what you're doing for them as a clinician. If we jump into our next data set here, this is their positional awareness. This is, or like kind of proprioception. So this is an interesting one where you certainly get more mixed results with the right arm. We saw that right away that there was actually a decrease within the number of subjects, and then just a tiny bit of improvement in the right arm after 2 days. But then in the left arm, we saw a massive improvement right away, and then an even bigger one after 2 days. So improving the proprioceptive ability certainly has a bunch of variables that obviously weren't captured individually in this data set, in that we have a left and a right arm that has such vast differences in numbers. But if I think back to my experience, certainly with athletes, and that's kind of the people that I would be considering helping proprioceptive awareness, well, whether it's a tennis player or a pitcher where they're recovering from an injury and they're just starting to get back into their sport. And I think back, there's numerous athletes who I've kind of sent on their way if they go back to school. If they came to see me for rehab of the shoulder, they go back to school if they're at university or whatever, and they want to take the shoulder pro cuts with them because they feel that when they're getting back into their throwing, that the awareness of the tape on the shoulder makes them more confident in their ability to do it in a pain-free way, in a more specific way. And so I would say that my clinical experience would be that this is very helpful. But really only for people who have high awareness of their shoulder, only for people that demand the proprioceptive awareness to be essentially back to where they would be in a normal state. So take that and apply it to your normal populations, where really the high body awareness people are the ones that will benefit from the proprioception in this case. And then, as a conclusions here, we see that essentially that with the EDS syndrome patients, that it is a common condition manifesting with decreased proprioception and shoulder active range of motion. These are people with pain. Kinesiology tape crossing the GH joint is an inexpensive, very true, and relatively safe intervention. I would say more than relatively, but there we go. And that may offer temporary improvements. That's only because they only tested for 3 days to shoulder rotation active range of motion. And then because they saw differences in the positional awareness, they didn't say that it was unanimous across the board. But certainly something to think about with this type of population, but also with all your patients who have a range of motion deficit or a positional deficit. All right, if we dive into our second study, we're going to quickly look at this one, and the benefit here is it's going to back up what we saw with our proprioceptive awareness. The cool thing about this one is that it was done with our shoulder pro cut as the tape that they used in the study. And they really, the same they did with the previous one, they looked at your ability to reproduce a degree or a range of motion that was specified. Essentially, are you able to kind of get back to that same position that you were in a second ago with tape and without tape? And what they found, not surprising, as I mentioned that there's numerous studies, is that kinesiology tape may add a clinical benefit for improving proprioception. And then this was both in internal and external rotation in the joint reposition sense. in this study. So we'll leave it there. Just another piece of the puzzle to add into our previous results, showing that if this is something your patients require, this is something that can help them. All right. So if we kind of dive into more of an education piece here, this is the ProCut that I would use to achieve a range of motion or joint reposition sense, proprioceptive sense benefit. And so we'll go through a video here, just kind of just showing how it is applied. The reason I would use this specific application really is simple, and it is because you get so much coverage around the entire shoulder. So we get it right over top of the AC joint. It goes over top of the supraspinatus, down kind of the medial border of the shoulder blade, across the infraspinatus, and then even as you can see now, it's over top of the deltoid, the tricep, and the bicep. So we get really maximum coverage of the shoulder, and it's that maximum coverage that's going to continuously send the brain feedback about where it is in space, which is why we get that improvement. The way that we see the range of motion improvement, the mechanism there is that the tape on the skin, the elasticity of the tape, it lifts the skin, it elevates it because the tape retracts back on itself, and that elevation provides a constant rub on the mechanoreceptors in the skin, and that constant stimulation of the mechanoreceptors helps to normalize the muscle tension underneath it. The same way that if you bang your elbow, you naturally will kind of give it a rub, and that natural inclination to give a rub is there because it helps to kill some pain, and it helps to decrease any tension or kind of change in tension that happens in the arm. So it's the kind of that constant feedback to the brain where we get that range of motion improvement and the proprioceptive improvement in the shoulder. All right. So we'll kind of leave that, and we will dive into, or we'll kind of prove further or give you more evidence to think about how the tape is going to help muscle function, and then essentially proving how we got to that range of motion benefits as well. So this study looks at the differences in muscle tone and stiffness with using kinesiology tape on the shoulder. And so we'll simply define tone as I think of it as kind of how, when I'm working with a patient and they're lying on the table, they're in a position where the muscles should be relaxed. It's the tension that I feel in the muscle while the patient is relaxed there. And then the stiffness would be the feeling that they get as to like, oh, that feels tight, that feels stiff. And so tone is like where the muscle is when in kind of a resting position, and then the stiffness is where the perception of what the muscle is in terms of, is it tight, is it sore, is it stiff. And what we see over numerous studies, and we'll kind of touch on a couple of them today, and the results seem very similar, again, to like if you can take this and you can think of it, how much improvement you can expect to see with your patients. Muscle tone tends to improve about twice as well, twice as much as stiffness does. So if we see with our study here, we have 1 day, 3 days, and 1 week, and this was looking at muscle tone over top of the supraspinatus. And so right away we saw that tape and exercise versus just tape and muscle stimulation and heat were the physiotherapy or physical therapy of choice. But so adding the tape in helped to get to about a 25% improvement right away or after a day, where the muscle stim and heat got to about 10%. And then you can see after 3 days we get to 34%, and after 1 week we get to about a 44% improvement in the muscle tone. Again, that is how the muscle is at rest. And so I'll kind of move away for a second, but like if you kind of if your patient's on the table and you can kind of feel that infraspinatus is really tight when they're lying on their stomach, or if their erectors and their low back are really tight when they're lying on their stomach, we can expect about a 44% improvement of that tension after about a week of function. So I'm getting tape on that all day, every day, knowing I'm going to get some good results. And then if we look at the stiffness, again, this is perceived as how they report the stiffness of the muscle. It's about half as much as we saw with the tone. So right away we saw an 8% improvement, and then after 3 days we get to 12, and then after 1 week you get to 16% improvements. And again, both ways there is obvious benefit compared to just doing muscle stim and heat alone. Again, adding tape to your treatment plan, showing benefit, and even when we kind of just continue doing exactly what we would normally do. And then in conclusion, as you can expect, this study underlines that physical therapy is more effective in improving muscle performance when it is combined with taping, and that the combined approach can be used as an important intervention strategy for patients with shoulder pain. Makes good sense. Adding tape in is a good idea, and leads to better benefit for your patients. Okay. So we will extrapolate that to a pattern that I kind of generally see, and that's why we included this next study, where we see a trigger point in the upper traps leading to shoulder pain, whether it's as bad as getting to like a shoulder hike, which is really what I was dealing with when I kind of saw instant benefit to using the shoulder ProCut. But we'll look at how the tape over top of the upper trap can lead to shoulder improvements, and then we'll look at some taping and how we can kind of tape to see that as well. So with this study, they looked at two different outcomes. They looked at the resting muscle tension, so like that muscle tone. They also looked at the ability to use or to deal with kind of pressure on the trigger point after the use of tape. And so within here, after a week of use, we saw that there is about a 53% improvement or normalization of the biological activity of the muscle of the upper trap, while putting kinesiology tape on there. So we saw that with the previous study where that muscle tone was a 43% improvement. Now we see it's a 53% improvement, but all in the same relative ballpark as to really significant improvement with just using tape alone. And then with our pressure pain threshold, we saw that after a week of use that we saw a 36% improvement in the ability to deal with pressure over top of that specific trigger point in the trap while using tape. Again, the function is greater, and then as well as the actual physical status of the muscle is greater while putting tape on the shoulder. And so as a result, they conclude that kinesiology tape is an effective method of increasing the level of pressure pain threshold and decreasing muscle activity during the resting state in subjects with upper trapezius myofascial trigger points. And judging by how many patients I see that have myofascial trigger points in their upper traps, with phone use, with computer use, with everything in life taking us this way, really, if you made a habit of just putting tape on everyone's upper traps, you probably would do pretty well. Even if they're coming in for something else, that probably would be a helpful thing to kind of help them deal with some tension through there. Not to mention the impact that stress and changing in breath patterns and going down that road has on the upper trap function. So yeah, this is a huge piece to helping a lot of your patients. If you take this information and apply it to your patient population. All right, so here is a video that we're going to go through and how I like to combine a pattern where we see upper trap tension, trigger points in the upper traps, as well as trigger points in the infraspinatus, moving down into like shoulder pain, and how those trigger points in those two muscles of the shoulder move down into affecting kind of shoulder positioning, and then we can also get some coverage over top of the biceps and the delts and the traps as well. So in this case, we used 2 strips from a roll. You'll notice that when we were applying here, I'm thinking my way through it, and really my thought process is on each of the muscles that I'm trying to apply over, I want to provide some stretch to the muscle and then apply the tape over top of that area. So when we start up into the upper trap, I'm going to side bend the head away. I'm going to kind of depress the shoulder, and I'm going to get the tape over top of the upper trap. And then as we get into the bicep, I'm going to kind of abduct the arm out, turn the palm forward to get a bicep stretch to finish it up into the front of the arm. And then as we get into the second piece, I'm going to bring the arm across the chest to stretch out the infraspinatus. And then as we get into the tricep, I'm going to kind of keep that position where the arm is across the body. And you can even kind of get into some elevation of the tricep if you wanted to, depending on how kind of posterior you go and how much into the tricep you go versus kind of getting into that posterior delt. So this is the beautiful thing is you can take this any direction you want based on the intricacies of your patient. But if you're thinking, okay, let's stretch the muscle that we're putting it on, and then as you move, you can get over top of any muscle you want with that same principle, and you're going to be very successful providing a kind of a combined application like this one is right here. Benefiting from as little tape use as possible, getting as much coverage as possible, and looking like a pro, and you know exactly you're kind of a guru with the tape with this type of application. Okay, so that covers our muscle tension, the explanation, the application, the proprioception piece. We're going to take a break from that, and we're going to dive into how we're going to tape for helping with kind of a structural postural improvements to affect the shoulder. So this is a massive one in that so many of our patients present with kind of a C posture, rounded shoulders, or we can do this to affect external rotation of the shoulder. Whatever range of motion, whatever posture that the person is lacking, the person struggles with, we can just promote that the opposite position and help kind of provide an addition to all the treatment you do, as well as you're going to send them on their way with rehab exercises. Well, if the tape's promoting an extended position, well, now those exercises get easier. If we're trying to do some external rotation of the shoulder work, well, then the tape kind of helps you get in those patterns. And so not only does it provide a kind of a pull or a reminder, but it also gets you into positions easier so that when you do your rehab, you can activate the muscle in a better way. You can get into the position faster that you want, and now the rehab exercises are more effective. So it's not just a crutch like a brace is. This is something that kind of promotes the postures you want and helps you get stronger in that position so that when you take the tape off, all of a sudden you can maintain those postures and those positions because of the muscle work you've done to promote that new posture or position that you want. Okay, so with this study, another new one, 2023, this is cool in that they looked at posture, but then also looked at the function of the ribs, function of the lungs as a result of improving the posture. So if we look at the next slide, which is how they taped in the case of the study. So they used 50% tension, and they use strips of tape like so, and this is the application that they applied. I do it in a little different way, which we'll go over at the very end, but it's very similar to this idea where we're using a little bit of stretch in the tape to promote a external rotated and extended position of the shoulder and mid-back. So if we dive in here, what we see in this study is that This was a interesting one where they had the tape on there for 2 weeks, and then they kind of combined that with some pec minor stretching, which makes sense. They used some pec minor stretching to kind of get in there. I would argue that if they used pec minor stretching, some sort of manual therapy or soft tissue therapy, as well as tape, then they would probably get even better results. But no matter, in this case, they did the after 2 weeks, and then they took the tape off and then reevaluated after 6 weeks. And so we see some interesting results here. Is that they right away we see a 20%, like 21% improvement in essentially the rounded shoulder position after 2 weeks. And then after 6, we see it improved to about 28%. And then after that, we kind of look at the pliability of the ribs, which improved after 2 weeks as well, improved more after 6 weeks. And then even the ability to use the lungs in a more efficient way, the diaphragm primarily, but they measured maximum inspiratory pressure, and so essentially the ability to use the muscles of respiration improved as well, even after the tape was removed and the stretching was stopped. And so just by continuing to find a better posture, we saw the results were improving. If we jump to this application video here, we see this would be the way that I would generally tape for it, to kind of get that same result. If my goal was I saw someone with glenohumeral, like internal rotation, and I wanted to improve external rotation, this is how I would tape for it. It's super easy, time efficient. A lot of times I'll use this is the Spidertech hip Pro Cut. You can also use a roll. I like the hip because it's wider, so we get more coverage. It gets provides a little bit more stability. And then when I apply it, we'll use the hip as an example, but I'll put the tape over top of, right around kind of where like the upper trap is, between there and the supraspinatus. And then I'll wrap the tape around the shoulder as the anchor point. Once I get that, I'm going to have the patient rotate their shoulders externally as far as they can, with their elbows at 90 degrees. So kind of we'll take this position. And then from there, you can choose how much stretch or tension you want to apply to the tape. It doesn't require very much. I mean, 50% would be tons. And then once I get past that bottom pole of the scapula, generally I'm either going to go no stretch, or even I can go into a flexed position to ensure that we don't have any extra tension on the edge of the tape. And that the reason for that is where the tape ends and the skin begins. You can imagine that the elasticity in the tape is going to pull back on the skin at that level. So that fault line where the tape ends and the skin begins is the spot where the tape is going to pull back in a maximal way. And so if you apply stretch or tension to the tape in addition to the elasticity, that's where we're going to get a lot of tension at that fault line. And so by having them kind of bend forward and making sure there's no tension at the very end, we're going to make sure that we can limit the skin irritation and really take that level, the chance of irritating the skin down to almost zero with your patients. And certainly we're trying to provide only benefit for our patients using tape. And so if they walk away with some skin irritation, some break in the skin, it's not going to be worth the squeeze. And so this is something that I'm really aware of to make sure that at no point we ever cause problems with tape. We're always just going to add benefit with using Spidertech. And then if we jump into the next video, this would be the one that I would use in a structural way to help with the upper trap trigger point, if the upper trap trigger point was also leading to a shoulder hike as well. So I'm going to get tape over top of the trap itself initially, and I'm going to do this in the way that I mentioned before, where whatever areas I'm putting it on, I'm going to stretch the muscle. So as we go up the erector of the upper T-spine there in the neck. I'm going to have them flex forward. As we get down over top of the upper trap, I'm going to have them side bend away for the first piece. And then for the second piece, which is the hip pro cut there, what I'm going to do is apply in a structural way, like we just mentioned. And so where the initial or the previous one where we looked at being able to looked at trying to improve external rotation, this one we're trying to promote getting away from a shoulder hike. And so the position that I'll generally use here is I'll have the patient take anatomical position. So they're standing or seated. I'm going to have them just drop their hands to their side, externally rotate their palms into a supinated position. And then I'm going to come up a little bit higher into the shoulder, not quite down quite so far. And then we're just going to do the same process where we go no stretch in the front. Once we get to about the beginning of the shoulder blade, or like that supraspinatus area, then we'll apply a little bit of tension downwards, really no more than like 50%. And then once we get past the shoulder blade, that's when I'll let the tension go and apply the rest of it without tension, or even maybe a little bit of flexion to make sure that we get no extra pull at the end of the tape. Again, I think the best piece of tape for the job here is the hip pro cut, but you can also use a roll as well and get good results. And so that would be the subtle difference I would use for a shoulder hike versus trying to promote shoulder external rotation or promote getting away from like an internally rotated glenohumeral joint. Okay, excellent. So that concludes our thoughts on stability, our thoughts on our structural application. We're now going to dive into how we can affect pain disability using. I'm going to a lot of times use the shoulder pro cut here, but how we can use tape to get there. So this is another brand new study. It is 2024 as well, and it looks at using kinesiology tape with exercise versus using kind of cold ice with exercise as well. So when they used ice, in this case, they did 20-minute applications, and they did it 5 times a day with exercise versus using tape with exercise. And they looked at it over a 3-day period where they tested before and afterwards. You can see here, this is the application that they used. I mean, it's interesting. We see that, and this is with people with tendonitis of the shoulder, but this would be similar with any kind of impingement of kind of underneath that AC joint of the shoulder. So, but yeah, it's interesting. We see here with the tape application, they get the tape up the upper trap, they get tape up the supraspinatus, as well as the deltoid, the infraspinatus, and then they even get a little bit of a kind of a structural pull into external rotation as well. So with this application, they really covered everything we just said, all the different pieces, with using three strips of tape. And then if we kind of dive into our results here, again, this is over a 3-day period. We see some interesting pieces. And again, what I like is this gives you idea as to what you can expect, but it also gives you what to expect using exercise and cold therapy as well. So resting pain, if we look at just the pain piece right away, resting pain with using tape, we can expect a 43% improvement after 3 days, or a 1.5% improvement, or 1.5 out of 10 improvement with the visual analog scale. And then with ice and exercise, we saw a 31% improvement. So we still see some improvement. With night pain and using tape, we saw that after 3 days, there was a 50% improvement. And with activity, there was a 26% improvement. And then versus with activity, the ice and exercise, we essentially saw a negligible 1% improvement with that. So this is where I guess we could see that the tape kind of shines, is it helps to promote more functional patterns within the shoulder, and it's because we get that constant rub on the skin. We get those changes in the tonicity, the function of the muscle. And so I think that's where the difference is between the shoulder, which is just trying to get in there, decrease the inflammation, which I guess is a little bit subjective, but and up for debate. But that's the difference between the kind of the icing and the tape, is that the tape is trying to have an effect on the muscle versus the ice on the inflammatory issues within the tendon of the muscle. We also look at with disability. We see that there's a 21% improvement with the DASH disability, which is, I think, what most of us use for shoulder issues for our objective measures. And then I forgot to throw in with the ICE, which was a 2% improvement with ICE. And so again, virtually no disability improvement with using ICE in exercise after 3 days versus a 22% improvement with the tape. And then, so we kind of will leave that, which is kind of our pain and disability piece. And then if we looked at the restoring range of motion, which we saw before, we see similar numbers here where restoring flexion after 3 days was 10% improvement with using tape, only 2% with ice. Restoring abduction, which in theory would cause impingement of the shoulder, 12% improvement with that with the tape, only 0% improvement with ice. And then internal and external rotation both were a 7% improvement in range of motion. And then we saw that the ice produced no improvement in internal and external rotation. And then lastly, they looked at grip strength, and with using tape produced a 10% improvement versus ice was a 2% improvement. So I think some great ideas, expectations here. I'm not saying we shouldn't use ice. I'm saying we could use them all together, but I'm saying that the tape is going to affect the body in a different way, and so that's something that we can add in addition to however you choose to fight the inflammatory process, whether it's ice, whether it's medication, whether it's any other manual therapy, whatever it is to try to control the inflammatory process. We can add tape on there to help with the muscle function, as well as what we'll see. We'll have an impact on fluid flow as well, but using the tape because of the lift in the skin. So. We will jump to the conclusion here, and that we see that the present study suggests that both using tape and ice in conjunction with exercise program could be used as adjunctive modalities for resting and night pain relief in the short-term rehab of rotator cuff tendonitis. Additionally, the findings revealed that combining kinesiology tape application with exercise program might be an effective therapeutic choice for improving activity pain, function, and range of motion, and the grip strength in individuals with rotator cuff tendonitis in the short term. This study also provides evidence of kinesiology tape could be more effective than ice at reducing night and activity pain and improving upper extremity function. Further randomized control trials should be done going longer. Yeah, so being that it's only 3 days, but that's very important. If someone has an acute inflammatory issue in their rotator cuff, chances are you're going to see them in less than 3 days anyway. And so that's kind of the expectation that we could see, in addition to the benefit of all the other things that you did to help them with their shoulder. Okay, and lastly, finally, we'll tie it all together with looking at the fluid flow, lymphatic benefits of using tape. And the mechanism of action here is quite simple. We mentioned how the tape, elasticity of the tape contracts up, lifts the skin to help with muscle tension and pain. This is the same thing with when we are dealing with any kind of congestion from being extra fluid in the area, whether it be lymphatic, swelling, inflammation, bruising, so on. So with this study, very interesting, they did a workout for the biceps that attempted to, an eccentric workout that tried to induce DOMs in the area. And what they saw was by putting tape on during the workout and for 1 day afterwards, so they took the tape off after 1 day, and then it was on there for 96 days, so for 3 more days there was no tape. They essentially saw an 8x improvement in the presence of creatine kinase, which they use as the objective marker for muscle breakdown and pooling in the area. So if there was no tape at all, there was 8,000 international units of creatine kinase in the area after 96 hours, versus if they had tape on there for during the workout, in addition to 24 hours afterwards, there was only approximately 1,000 international units of creatine kinase in the area, leading us to believe that the difference here is that the tape lifted the skin up over top of the muscle, over top of the bicep, and allowed the muscle breakdown, allowed the creatine kinase that happened as a result of the breakdown to build up of the muscle to flow out of the area and not get pooled and congested on the arm. Here we see our kind of a breakdown there after like 1, 2, 3, and 4 days, what you'd expect, no tape versus 24 hours of tape. And then we extrapolate that to, okay, so we know that if there's less fluid in the area, there's less byproduct from the muscle breakdown. Well, what does that mean in terms of sensitivity of the nerves? What does that mean in terms of restoring range of motion? What does that mean in terms of strength recovery? And we see some significant improvements, again, by just having tape on there during the workout and afterwards. After the 93 hours, we're essentially back to almost full strength recovery versus no tape. We're essentially at almost a 1 out of 10 for soreness versus no tape, which is 4.5 out of 10. And then we snuck out even a significant improvements in range of motion, extension of the elbow, 111 degrees versus 93 degrees with using no tape. So just by proactively using tape on the skin, we see these benefits days down the road with they're kind of functional and very real. Like I think where I see these is certainly within tennis. We also work with a lot of cyclists that benefit from this as well. That after a hard workout, we're getting tape on that area right away because the athletes know they're going to wake up the next day feeling better. They don't feel puffy, they don't feel congested. We get the fluid out of the area, and their function, their ability to perform the next day, both cycling and tennis, very important, is significantly improved. Okay. And then as a result, we see that our conclusion is that we should use tape 24 hours and during the workout to see significant benefits in function. And then if we dive into what the tape would be that I would use to see this. So this is the Spidertech fan. It's our piece that we use for lymphatic drainage. It's the piece that we would use for any kind of fluid transfer issues. And so what I'm going to do as we're getting it over to the bicep here, this is something where if there was any, for DOM certainly, but any kind of bicep tendonitis on both the distal and proximal ends, I'm going to use this tape on this application here. I'm going to apply it with the arm extended and the bicep fully stretched. I'm going to get tape over top of the area that we want to affect. And then I'm going to aim to where the tape strips are approximately 1 centimeter in width, and I'm going to aim to leave about a 1 centimeter in width in between the strips. Benefit, or the reason for that is twofold, that the tape alone retracts on itself, lifts up the skin, so we get the congestion to move out. But then with the areas of tape, no tape, tape, no tape, we create an osmolarity gradient difference. We create an environment where there's less pressure on the skin underneath the tape because it's been lifted up, and we can promote the fluid to move in the areas of least resistance. So areas underneath the tape that pulls the fluid, and so we can get the fluid to move out of there even faster than we would if it was just a normal strip by itself. So whether it's the shoulder or any other part of the body, I'm using the fan ProCut here all day, every day, if there's lymphatic or any other fluid drainage issues. All right, fantastic. So as a review, these are the patients that we reviewed: range of motion deficits, proprioceptive deficits. We looked at how we can improve muscle tone, which kind of ties back in there, tone and stiffness. We looked at how we can improve our postures of our patients to help with shoulder function. We looked at just kind of how, from a diagnostic pain and function standpoint, disability standpoint, we can have an effect. And we looked at also how we can have an effect on lymphatic or any other fluid transfer with using our kinesiology tape. As always, and as I imagine you've seen with our 13 webinars here, we have tape for every patient. Everyone can be helped. If you more you understand about using Spidertech, the more that you can have an impact on your patient's health in life. And then not only is our ProCut easier to apply, lasts longer, it also looks better. And so your patient goes out in the world, it's a conversation starter, because other people see this product that looks professional, high-end, and then they start asking about your therapy, and it is a reflection of your high level and high competency of therapy. So that ends up being a business card or a conversation piece for your patients to talk to other people about your care. Okay. That concludes webinar 13. Let's jump into Q&A. Shoot us your questions that we got about this or anything else, and we'll get the chat going. So tons of info today. I hope that gave some ideas and different ways we can tape with different diagnoses. The shoulder is such like a multifactorial area of the body. So like we take a diagnosis, and there can be multiple ways or reasons why the diagnosis exists. But if you use the tape as an extension of your hands, if you kind of feel where the dysfunction is, use the tape over top of the areas that you feel a dysfunction. I think that's going to be where you get the best results versus just using it. Here's your diagnosis. Here's your application of tape. Yeah. So frozen shoulder is certainly a tough one. So a lot of times it'll be just how much promotion of external rotation we used was going to depend on their level of pain. We certainly want to push the envelope, but not cause problems. I'm definitely getting tape on the skin, like we showed with our ProCut, or essentially just kind of like we're getting tape over the shoulder with the goal of kind of creating some constant stimulation over top of the skin without stretch. And then I will decide based on their presentation how much external rotation I try to promote as well. Whether it is getting it over top of the GH joint with this one we went over, whether it's being a little bit less aggressive and kind of just resisting the shoulder hike, getting up into the upper trap. Those are the two things I'm kind of thinking. I'm definitely getting some stimulation over top of all the muscle, and then how much rotational, structural support or promotion do I want to kind of push? And that's something that's going to constantly evolve every time I see them, in terms of like how much we can push the envelope in promoting external rotation. Can a pregnant woman get this kind of therapy on her erector spinae to support lower back pain, and also on the shoulders to support better breathing patterns? Yeah, great question. So there's tons of really good research on using tape over top of the erectors to help with pregnancy, and the results are like the numbers that you see in those studies are fantastic. We've used our low back pro cut over top of the erectors and up laterally over top of kind of like the obliques, up in kind of like the TL fascia. We also get some tape on the abdomen as well to essentially, I think it just kind of cushions the transition when the pregnant ladies move. I think it just kind of provides some awareness, provides some kind of support, some stability in the over top of the abdomen, so the skin doesn't get stretched quite as much. It doesn't put quite as much pressure on the low back. But if we get tape on the abdomen, we get tape on the low back, the pain levels, the disability levels, are pretty impressive. In addition, and so yeah, I would definitely hit the erectors as one of the important piece there. And then for breathing patterns, yeah, so I would two things. I'm going to get tape on the shoulders. I'm going to get tape on the mid-back, kind of what we said to help with breathing patterns. I would also kind of get tape over top of the abdomen, probably starting underneath the belly button, kind of just above the pubic hair, and just get tape kind of around the abdomen, and then up into where the diaphragm is underneath the ribs, just to kind of provide some kind of support through here, like through the rib cage into the abdomen. And I think that's where we're going to get those breathing pattern improvements as well. Again, we're not going to pin it down. We're not going to stretch it and try to like cradle the stomach. We're just going to kind of lay it over top of it so that there's constant awareness over top of the abdomen. And then when we get changing directions, all of a sudden there's kind of like a cradle to provide some support over top of that area. But yeah, I would also really consider getting into the shoulders and mid-back if you felt that posture in through that area was poor, and they were kind of getting those rounded shoulders. They were getting the shoulders up hiked as well. Thanks, guys. Two great questions there. And I'll add in with the frozen shoulder as well, is because we're going pretty hard at those ones, because we're really trying to get into that tissue and kind of promote that external rotation. The tape over top of there to help kind of deal with the soreness afterwards, in the treatment, like the time between our treatments. I think the tape is very helpful with that as well. And I will say that test out these numbers that we have today. Do test, retest. I would expect you to see these same type of improvements in range of motion in tension right after you apply it. So put the tape to the test, kind of show your patients the benefit they're seeing right away, and it'll only help with buy-in for them for sure, but also for you. Like that's where I really was. Get comfortable saying and doing these things is when we do the in-person seminars. I know that we're gonna see those range of motion benefits right away. That everyone there is, whether they're skeptical or not, is going to kind of see the improvements objectively right away, and that certainly helps with the buy-in. I will say lastly that our schools platform that you can get through our MedPro certification is something that everyone should be taking advantage of, in that all the information we went today on the previous 12 webinars, as well as all of our virtual education pieces, is all housed on our school platform. Once you sign up to be a MedPro, which is free, you'll get a invitation to join the school platform, and it's just chock full of how to tape, why to tape, and everything you want to know. You also can access me there. You can access everyone else in the community to ask your questions and really educate yourself in a thorough, quick way, but also in a free way. Everything there is free of charge, and we're doing that for the simple reason as our goal is to sell kinesiology tape. We do a very good job of making it. We want to sell lots of it. And so if we can arm everyone here and everyone in the world with the knowledge of how to apply it, how to use it, how to help your patients with it, then we expect to sell a lot more tape. So we're providing everything there free of charge. We want everyone to take advantage of it. It's high quality education and information, and check it out. I'm sure you, whether you do it as using it as like a form that you constantly are on, or just a place you go to get the questions answered that you have as they come up. It's a great platform to answer all those questions that you have. Can a person wear kin tape to help the recovery after a second-degree burn on the foot? So the answer to that one is yes. The answer is you have to use your clinical expertise for that one. I would certainly be using our gentle line of tape, being that the adhesive is more gel-like and it's softer on the skin. We have surgeons here in Ontario that use that line of tape in the burn unit to kind of take advantage of healthy skin after a burn, to provide some support or protection for healing skin after the burn. You're going to have to make sure that you don't cause stress to the skin as it's healing. But once it can handle it, the protection that tape gives to the skin is very significant, and it's something it's a tool that once you understand how and why to use it, there's as I said, there's very impressive surgeons that are using it here in Ontario that I know of, and I'm sure around the world for just that reason. So it is something that we've spent a lot of time on with burn, and also essentially using it as kind of like steri strips as like a way to connect healthy skin that isn't quite so rigid. But yeah, so it's something to consider both from a burn standpoint and from a scar standpoint, as well as a way to really help your patients, and it gives the pliability and the support to the skin that it needs. Essentially, how it's working is it goes over top of the burn or the scar. It retracts back on itself in a gentle way, but then as you move around and you use that area, the natural stretch on the skin would keep pulling on that injured tissue, and that would normally kind of keep tractioning and affect the burn or the scar. But the elasticity of the tape retracting back on it is enough to counteract that stretch in the skin, and so it essentially allows the skin to heal in a natural way without being tensioned and re-injured every time you use the area. All right, everyone. Thank you so much for the questions. This was fantastic. A great topic. I hope it helps a ton in your clinic. Any further questions, fire them in the school platform. Check out all of our Instagram application videos. The videos we saw here in the webinar are all listed there. Great way to give ideas as to how to apply tape for different diagnoses. And I look forward to seeing everyone again soon, and I hope everyone has a fantastic day.